Hello, my name is Madison Neal, a junior at Frisco Reedy High School and a member of the Independent Study and Mentorship Program. This year, I decided to study into veterinary surgical specialization, take a further look into hip dysplasia. This video is to hopefully help owners recognize the symptoms of hip dysplasia in their puppies at a young age, which will overall help the animal's quality of life and save them money in the long run. First, to begin, what is hip dysplasia and what breeds are most commonly affected with it? Hip dysplasia is a genetic disorder when the ball socket joint does not fully form around the femoral head. This creates a laxity within the joint, which causes grinding and overall pain for the animal. As mentioned before, hip dysplasia is genetic and is most commonly found in large breed purebred dogs such as golden retrievers, labradors, and German shepherds. The best case scenario for this disorder is early diagnosis. Here are the common symptoms found in puppies that owners should look for. The first is a reluctance to play. This should be the first key into an owner that something is very wrong and is very painful for the puppy. Puppies have an extreme amount of pent-up energy that they release through playing. And if they are reluctant to, it most often means that something is very painful for them. The next most common symptom is if your puppy is early to fatigue or to exhaust early. This symptom may be difficult to understand for first-time owners or for owners who only have one puppy at a time, considering they have no other basis to rely on. However, if you take your animal on playdates with similar ages and breeds, it'll be easy to understand. Next symptom is the bunny hop gait or the type of walk. This symptom is most easily understood, however, it is most common in more painful scenarios. The bunny hop gait is when an animal will use both hind legs to either walk around or to go upstairs, as using both individually hurts more. And then the last symptom often found in puppies is the reluctance to jump on couches, chairs, beds, and or to go upstairs, as it causes added stress on their back end. As your dog matures, these symptoms will ultimately remain the same, but they will become more easily distinguishable as the disorder progresses. In more extreme cases for adult dogs, most commonly their back muscles will be underdeveloped in comparison to their front end, as they're using their front end to compromise for their back end. In addition, they may also develop a sway in how they walk with their back hips. The best way to explain this is it appears as if they are strutting when they are walking down the street. Next, we'll look into some preventative care that you can take as an owner when your animal is still a puppy. As always, please discuss with your veterinarian if you feel as if your animal could possibly develop hip dysplasia as they age. First and most important is to keep your animal at a healthy body weight. While there's no correlation to the development of hip dysplasia and overweight, there is a correlation to the worsening effects of hip dysplasia and being overweight. Secondly, joint supplements such as glucosamine are available. Glucosamine is able to help with the development of joints and cartilage. However, please talk to your veterinarian if you plan on using them to be able to make sure you have a healthy dosage for your animal. Next is to watch your dog's exercise. Regular walks and play, along with a good diet, should be able to keep your animal at a healthy body weight. Too much long-term running can actually do more harm than good for your animal, as it causes increased pounding and stress on the joints, which can lead to grinding and early development of osteoarthritis due to the laxity the hip dysplasia causes in the joints. Next, we will look at the surgical options commonly available for hip dysplasia. The first option is a preventative surgery known as pubic symphysis. It has a window of opportunity from 6 to 12 weeks of age and also has the lowest cost of all the surgeries at approximately $1,500. Its recovery rate is at 2 weeks. The second preventative surgery has a window of maximum 6 months of age. The second preventative surgery is known as a TPO. It has a window of opportunity ending at 6 months of age. It is the second highest costing at close to $3,000, but in addition, it has a 2-week recovery period due to the young age that the surgery is performed on for the dog. The next two surgeries are performed relative to the severity of the disorder and also have the longest recovery times. The FHO surgery removes a portion of the femoral head that was once grinding against the ball socket joint due to hip dysplasia. This surgery has an average cost of close to $2,500. The final surgical procedure for hip dysplasia is known as a total hip replacement and is just what it seems. The average cost is between $5,000 to $6,000 and has a recovery period from 4 to 6 months. This surgical option should be a last case scenario for all owners. Quality of life for an animal is a top priority amongst owners and veterinarians alike. With early diagnosis of hip dysplasia, owners will be able to grant their animals quality of life for many extra years. It will also allow them to enjoy life and enjoy where they are. Hopefully this video has helped you and about learning how to distinguish the symptoms of hip dysplasia and how you can possibly help your animal live a better life in the future. Thank you.